Hi guys, this video is about Shockwave and whether or not it's useful for Achilles tendinopathy. So what I'm going to look at is how Shockwave therapy actually works. Then we're going to look at what the research is showing. Does it help for Achilles tendinopathy? And lastly, how I would sometimes slot it in with my rehab program for my Achilles patients. So my name is Maryke. I'm one of the physios from treatmyachilles.com, where you can get online physiotherapy assessment as well as treatment for your injuries. So have a look at the link to our website is in the description of this video if you want more information about that. Good, so what is Shockwave therapy? Basically, the machine has a gun where there's a cylinder and there's a piece of metal that moves really quickly inside. Now it's not that piece of metal that makes contact with your skin. That metal actually just makes contact with another piece of metal at the front of the gun that doesn't move. And because it crashes into it, it makes a loud noise, so it creates a sound wave. That sound wave is then transferred to your tissue, and that's what causes the therapeutic effect. So you usually have gel, ultrasound gel, that they use with the Shockwave machine. Now, it's been shown to help for pain management in a whole horde of different soft tissue injuries. But we don't actually know why yet. They've got ideas, but they're not quite sure how it works. What does the research show for Achilles tendinopathy? Actually, it's quite positive at this stage. It does show that it may work. The problem is just that the research studies are of quite low quality at this point. There aren't any strong randomized controlled trials where they look at Shockwave versus other treatment. And you have to do that because otherwise the Achilles tendinopathy could have just gotten better by itself or through other measures if you don't compare the two. The few trials where they have compared it to other treatments and Shockwave was shown to be the best is a bit problematic as well because they've often used other treatments that we know doesn't work. Like for instance, for insertional Achilles tendinopathy, the one study used eccentric heel drops and we compared Shockwave to those. Now we know that for eccentric heel drops usually makes insertional Achilles tendinopathy worse. So I could have told them that the Shockwave would probably look better at the end of that study compared to the eccentric heel drops without even knowing the results. So there's a lot of research still needed, but some of the studies that's a bit better than that one or better designed than that one is showing that it may be useful. In clinical practice, I have seen good results with it, especially for my patients with insertional Achilles tendinopathy. And especially for those guys who are so sore that we just can't start the rehab. Anything, even the most low load exercises aggravates their pain too much. For those patients, the Shockwave therapy has been really, really useful. So it's not a standalone treatment. You can't see it as an ultimate cure for Achilles tendinopathy, but it's definitely got a place in the rehab process. The only downside is that it's quite expensive. So you need between 3 to 6 sessions usually to see a good result. And each session can cost quite a few pounds. It can cause a bit of treatment soreness afterwards, but I've not had many patients complain of soreness that lasted more than a day or so. And usually paracetamol just takes it away and helps for it. So yes, if you've got an Achilles tendinopathy that just does not want to allow you to get going with your rehab, Shockwave may be an option for you. So let me know if you've got any questions. You can ask them in the comments or just email me direct. But if you need more help with your injury, you're always welcome to consult us via video call. Link is in the description of this video. Take care.